Good afternoon or good evening, and thank you very much to the co-chairs for the opportunity to present today. I'm Arabelle, I'm a neurology fellow, and I started at Calvary about 6 months ago. And at the beginning of that 6 months, I was handed a beautiful data set of amazing data about health literacy and motor neuron disease. And I get the privilege to be able to present the results to you today before it goes to publication. So what is health literacy? Health literacy is a lot more than what might be the first thing that comes to your mind, which is, how well a patient can rattle off the list of the medications, or for instance, who's keen to pick up all the pamphlets around high blood pressure or diabetes in their GP clinic and take them home and actually read them. That is health literacy, but it's a lot more than that. So at an individual level, health literacy encompasses a person's knowledge, their confidence and their comfort to be able to go out and access information, to be able to read it, to appraise it, and use that information for the benefit of their own health and well-being, but also for the benefit and health and well-being of others around them. At a system level, we talk about health literacy responsiveness, which is how well healthcare workers and healthcare organizations and systems are able to accommodate and for the diversity that exists in health literacy in a population to make the health environment more enabling for everybody. So why does health literacy matter? So we know that poorer health literacy is associated with poorer health choices and outcomes. What we mean by that is reduced ability to self-manage your condition, increased hospitalizations, increased morbidity and mortality. For a condition like motor neuron disease, there is such a sense of urgency to become an expert in such a short amount of time upon diagnosis. So this is why it matters in motor neuron disease. Up until this point in time, there hasn't been any comprehensive research into health literacy in motor neuron disease. So the aims of our project were to firstly identify the health literacy strengths and challenges for those living with MND in Australia across different demographic settings. And secondly, to use that data to create, using cluster analysis, to identify nuanced health literacy profiles in order to uncover sort of individualized, tailored interventions to improve the health outcomes for people living with MND and their carers. From the data I'll be talking about today, our plan is to go forth and co-design interventions to improve the quality of life of those living with MND by addressing all of these challenges that we have identified. So a bit of an overview of the project. The first part was an anonymous online survey, which was disseminated during the height of COVID in 2019 and 2020. We collected sort of the usual demographic information, as well as people living with the disease were asked to complete the ALS-FRS score to look at severity. Everybody was asked to complete the depression, anxiety and stress scale to look at mental health, and carers were asked to complete the Zarat caregiver burden scale. All participants were asked to complete the health literacy questionnaire and e-health literacy questionnaire, which was designed from Swinburne University. It's part of the Ophelia methodology, and it's now a World Health Organization endorsed tool for co-designing changes related to health literacy and is widely used now. So there's 9 domains within health literacy questionnaire and 7 within the e-health literacy questionnaire. So from the scores from these questionnaires, they were used to group participants according to similar scores to create different clusters of health literacy profiles for both people living with the disease and for carers. It was really important that we included smaller clusters where there were only 1 or 2 people, as these were thought to represent often sort of hard to reach groups in the population. So that's why you'll see in the results there are quite a lot of cluster profiles. So from these cluster profiles, we then created sort of a narrative or vignette, which was used to stimulate conversation in these small idea generation workshops. So at the end of 2023, there were 6 workshops in total, where we had 12 participants with lived experience with MND across 2 groups, and frontline healthcare practitioners being part of 4 different workshops. So they were separated, and these were recorded, and then we performed thematic analysis to try and tease out what the key themes were. So as to the results, we had, considering it was COVID, we had pretty good response rate. So we had 227 participants who completed the survey. 171 of those were people living with MND and 56 carers. Overall, a reasonable distribution of males and females, but you will see there were far more females in the carers group, 82.5%. And as it was a Victorian-led study, we do see some geographical bias with 76.8% of participants being from Victoria. Most patients were living in major cities, but we did have about 25% living in regional mostly, rather than remote areas of Australia. There was a good mix of high level of education, but those who completed their education at secondary school were about 22%, which does fall below the Australian Bureau of Statistics average in 2020, which is about 35%. And we had about 37% having achieved a bachelor's degree or higher. So as to our cluster profiles, so this is a heat map which identifies 15 health literacy profiles which have been alphabetized from A through to O. So those health literacy profiles higher up in the alphabet represent higher health literacy scores, whereas the lower health literacy profiles are lower in the alphabet. Green representing highest mean scores, yellow, medium, red, lower. We condensed it to including all of the 9 health literacy domains and just 3 of the e-health literacy domains. I'm just, in the interest of time, only going to focus on one of the cluster profiles today, which is cluster C, just to give you an idea of the kind of information we were able to tease out from this. So cluster C is a group that represents relatively high health literacy scores. As you can see, all of their scores were in a green range. They were a group where the mean age of 67 years, with a fairly high number, 44% having attended university and 48% having previously worked in professional jobs. You might say, well, that's pretty good. Is there much to work on? But I'll draw your attention to domain 2, which is about having sufficient information to manage my health. And you'll see that there is a slightly lower score in that section. And what we were sort of able to extrapolate for this group was that there's perhaps room here to be giving these people in this group higher level of information. They may be wanting access to research papers, for example. And I think this is best illustrated when we wrote the vignettes, and the fictional person ascribed to this cluster profile is Norman. And so I'll read out Norman's vignette. So Norman has established a good relationship with all of his specialists. He knows what questions to ask to make sure he can explore all of the options of the best kind of care for himself. He keeps looking at the internet for information. He really wants more information, especially about the latest research development and treatments, but he's just not too sure how to access the latest research papers. Norman believes science is on his side, and knowing more will certainly help him to make better decisions to manage his condition. So these are the kind of vignettes that we use to generate really rich discussion in these idea generation workshops. So what we have done and what I want to focus on are the results from the workshops. So what we have distilled it down to is 4 key themes that we want to take forward and make changes related to. Within those 4 key themes are 17 key action areas. So the first area is focused on accessing reliable information. What kept coming up from people was, where do I look for information? And when I find that information, how do I trust what I'm reading on the internet? I think particularly today, there is so much content out there that already in such a daunting condition, it's hard to work out exactly what information you can trust. And so what we have derived from that is that we need to be consistent and to have one central source of information where clinicians are guiding patients towards, and that we all trust that is updated continuously with the latest evidence. The second area is focused on support for shared decision-making through a lens of compassionate care. And what we mean by this is that what came up frequently was the fact that there are such important time-critical decisions in the journey with MND that if we perhaps mapped them out and illustrated them in a way that is accessible to people who are at the beginning of this process, realizing things about the timing of peg tube insertions, NIV induction, etc., and making that clear to everybody part of this, involved in this journey. So, and the other thing related to that, and so peg tubes came up a lot in these workshops. And the other important thing is about including families earlier in these conversations. And as Marnie pointed out before, it's not about having one conversation and then that's the end of it, but revisiting things over and over again and giving people the opportunity to come back to it. Number 3, so action areas focused on accessing health and community services at the right time. So as a separate talk entirely, one thing that came up was the uncertainty that exists pre-diagnosis and that void that people live in before they are connected. Related to that is about having help to navigate the healthcare system, getting from GP to specialist to a multidisciplinary clinic. And lastly, action areas focused on training and capacity in health and community services. One area that sort of links these all together is about fostering in our healthcare workers in this space reflective practice and building on communication skills in order for people to have the difficult conversations that need to be had. So the take-home messages are that cluster profiles represent subgroups within the MND community with unique and diverse health literacy characteristics. Clusters with generally higher scores, like the one we looked at today, which is cluster C, reveal opportunities to build on the existing strengths that exist. We didn't get time to explore the lower health literacy clusters, such as clusters J, K, and M, where there were trends towards higher levels of anxiety and depression, more advanced disease, and lower levels of higher education. A really important part of this project has been that the workshops generated really rich data about the human experience of living with MND, and they've provided us with these targets for direct action, which, pending funding, we will go forth and prioritise these, completing the methodology, implement them, and work with our key stakeholders. Thanks for your attention.